Well, hello, my YouTube family. This is Dr. Lee, and welcome again to another one of my videos. So today I wanted to talk to you about indirect care. With Prometric, they grade on indirect care throughout all of the 5 skills that you'll be tested on during the nurse aide examination. So with that, I have a little PowerPoint that I put together that I want to show right now. And hopefully after we get through, you'll understand what indirect care is about and the importance of indirect care during your nurse aide skill exam. So I'm going to share my screen and we will get started here. Okay, so when we talk about indirect care, just exactly what it is, why is it important to us? Reason that indirect care is important is because you will be graded on indirect skills for all of your 5 skills that you're doing with Prometric. There will be a part of indirect skill on all 5 of your skills. Now, when you start your nurse aide skill, you have to be able to call your patient by name. So if you don't know who your partner is going to be, you can ask the person what is his or her name before the skill starts so that you can call them Miss Jones, Mr. Jones, or whatever. You can use an appropriate title. You never ever want to call a person by the name of sweetie, honey, darling, baby. It has to be Mr. or Mrs. and the person's last name, especially during the skills testing. So this is one part of the indirect care skills that is very, very important. How you approach your client and what do you call your client, okay? So Prometric has been very nice to tell us that there are checkpoints for us to know when we're going to be graded on indirect care for our skills. So let's take, for example, the skill indirect care. I want to read this little paragraph that's on top, and I'm going to emphasize some of the words that is on this little paragraph. So I'm going to start off. It says, indirect care is a skill that is evaluated while you perform each skill. So keep in mind, for every last one of your 5 skills, you will be graded on indirect care. This skill evaluates behaviors that are common to any resident care, such as infection control, safety, communication, and resident preferences, needs, comforts, and rights. You are not, keyword, you are not given instructions to perform the indirect care skill. Very important point there. So if I'm not given instruction, that means I better know when to do indirect care before I start my skill exam. Okay, so go back and read that. You are not given instructions to perform the indirect care skill. The evaluator watches for these behaviors while you perform each skill. Another important point here, the evaluator is going to be watching you to see if you perform these indirect care skills. Now, some people will say, I don't like people watching me and following me. Well, I'm sorry. During your state exam, the evaluator will be following you around and watching what you do so that he or she can grade you on these indirect skills. In the checkpoints provided for each skill below, indirect care checkpoints are identified with an IC at the end. Indirect care is one of the 5 skills scored in every clinical skill test. I'm going to repeat that again. Indirect care is one of the 5 skills scored in every clinical skills test. The indirect care checkpoints are And we have 7 that are listed here. So number 1, does the candidate greet the resident, address by name, and introduce self? So every time you start a skill, I don't care if you did it for skill 2 and skill 3, you're going to have to come back and do it again. Hello, my name is Miss Lee, and I am here to do XYZ. Good morning, Miss Jones. Good morning, Miss Lee. You're going to have to do it for every skill. You are being graded, and they have already told you this in advance. Number 1, does the candidate greet the resident, address by name, and introduce self? Number 2, does the candidate provide explanations to the resident about the care before and during care? You graded for indirect care. So I can't just come in and say, good morning, Miss Lee. I'm here today to give you a bed bath. I need to talk to you during the care because I'm being graded on that as a part of indirect care. This is important. You do not want to flunk a skill because of indirect care. Prometric has already told you in advance what I'm going to be grading you on for indirect care. Number 3, does the candidate ask the resident about preferences during care? So some of those preferences, if I'm given a bed bath, how is the water temperature? Is this comfortable for you? When you're getting ready to transfer someone to the wheelchair and you sit them on the side of the bed, you may say, Miss Jones, are you comfortable here? Do you feel dizzy? Are you feeling okay? Is the gate belt feel a little tight? Those are comfort things that you can ask the patient about while you are performing your skill. You are being graded on. Asking the resident about preferences during care. Number 4, use standard precautions and infection control measures when providing care. Wash your hands, put on gloves when appropriate. Ask the resident about comfort needs during care or before care is completed. So we already said that I'm going to be talking to you while I'm doing the care, but before I say I am through with my skill, I'm going to ask you some more comfort needs. Miss Jones, would you like the head of your bed up or down? Would you like the light on? Would you like a magazine? Something like that. Any kind of comfort need, just come up with something and just use the same thing over and over for each one of your skills, but you have to do it because you've been graded for it for each skill on these indirect care. Number 6, promote residents' rights during care. And number 7, promote resident safety during care. These are the indirect care skills that we will be graded on. And I'm going to go through a list of it toward the end of this presentation about the different indirect care skills for each one of the skills that we have. All right. Now, something else that we will be graded on as far as indirect care, and that is knocking on the door. Before you start each skill, you want to knock on the door. Make sure the door is closed, knock on the door. When you come in, then you want to introduce yourself, tell the resident what it is that you are planning on doing for him or her. Okay, that is a part of indirect skill. Make sure you stand out, knock on the door. When you come in, close the door. That's providing for privacy for that patient, and that's for every skill. You want to make sure that your hands are clean before you ever touch that patient. For every skill, you want to make sure that your hands are clean. These are a part of indirect care skills. The importance of the call light when testing. You want to make sure that the call light is in the hand that the resident can use to call the nurse. Now, we know that we've been taught the call light is very important. I teach you, please, if you need any help, push this button and I'll come to you. Well, if you put the call light on a dresser, on a wall, or somewhere where I can't reach it, I can't call you. So the call light is very important for the resident to be able to contact us if he or she needs any type of assistance while they're in our healthcare setting. And it has to be in or close by that hand where they can reach it. And it has to be the hand that is not weak, the hand that is not paralyzed. So I have to pay attention to this when I am doing range of motion with someone who has a weak, and if the evaluator says a weak right arm. So if the patient has a weak right arm, that means that the call light needs to be in the left arm. I got to keep that in mind. If I am helping someone to get dressed and the evaluator says they have a weak left arm, I need to put that call light in the right arm. I have to pay attention to this, because these are things that will make me not pass a skill with Prometric. And remember, for Prometric, you have to pass all 5 skills, 100%. So this would be a costly mistake, putting that call light in a hand, just in any hand, when the evaluator has already told you that this person has a weak right arm or weak left arm. It needs to go in the opposite hand. I'll point this out again once we get to the indirect care for the range of motions. Communication, we've talked about that, very important. When I come in, I need to greet you by your last name, putting a Mr. and Mrs. on it. I need to tell you who I am. I need to tell you what I am planning on doing for you. Make sure that you're okay with that. I need to be talking to you throughout the skills, making sure that you're comfortable, you're not dizzy, you're not weak. I need to communicate. Very, very important as a part of my indirect care skills. Very, very important. Now, for Prometric will tell us in the skills checklist when the agency wants us to wear gloves, when it is important, and when we're going to be graded on wearing gloves. If you put on gloves when gloves are not required, you will be graded under indirect care on how you remove them and when you remove the gloves. So what I teach my students in the nurse aide class that I teach is anytime you remove your gloves, you put them into the trash, and the next thing immediately you better say is, I wash my hands. If you don't, and you touch anything before you wash your hands, even though you put the gloves in the trash, you will flunk that skill, because this is under indirect care. So I tell my students, if gloves are not required for this 30 minutes that you're testing, don't put them on, because that's one less headache that you have to worry about while you're doing your test. But if gloves are required, and Prometric will list when gloves are required, put them on, and you better take them off correctly. Okay, and we'll talk about this once we get to that section later on in this presentation. So there's a time when we should put gloves on, and there are other times when I may think I need gloves on, but the state doesn't care about it during the testing process. All right. Now, the bed position. I get a lot of questions about, well, you know, Dr. Lee, should I raise the head up? Should I raise the bed up to my waist level? Because that's what I've been taught in school, is to raise the bed up to my waist level so that I'm not doing a lot of bending. It saves on my back. If you have an electric bed, that's fine and dandy. You can raise it up, but you better remember to put that bed back down. Now, this is another instance where it is not required during the state exam to raise that whole bed up to your waist level. It is not required. It is not listed as a step. So therefore, I teach my students, but it's up to you to do what you think is best for you when you take the state exam. But I tell my students, leave that bed alone. Whatever level that bed is at, leave it alone. for the 30 or 40 minutes that you are in that room doing your state exam. And if the state does not tell you to raise the bed up or down, why are you doing it? Because if you forget to put it down, you just flunk the whole state exam, all for doing something that is not required. So for raising the whole bed up to your waist level, that's a personal choice. And I'm not going to tell you do it or don't do it. You have to decide if that's something you want to take a chance on. But I can say with assurance, it is not required during the state exam. Also, during the state exam, you do not have to go around and go lock, 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 lock for all 4 of the bed wheels. That was something that we was doing during the testing under Pearson VUE. We are under Prometrics now. Prometric does not require it. So I need to change my way of thinking and think like Prometric now, because Prometric is the one that's going to be sending out an evaluator to grade me. So I want to be thoughtful about that and start thinking the way Prometric think and do my skills the way that Prometric wants me to do the skills, and not the way Pearson VUE wants me to do the skill. So I'm in Texas, and those of us who we just left Pearson VUE, I think September 1st, 2020 was our first month of testing with Prometrics. So a lot of people are used to doing things the way Pearson VUE did it. You got to get out of that mindset. And now you got to start thinking the way Prometric wants you to do it. Okay. Prometric does not say raise the whole bed up. Prometric does not say go around and go lock, 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 lock for the wheels. Prometric does not say put the side rails up when you're turning somebody or when you're moving patients in bed. Those are not NOT. Those are not guidelines for Prometrics. And after you listen to my presentation, if you find that in any one of the skills guidelines, comment below and let me know. Put me in check. But I'm telling you, I have not seen it. And I'm making this video on January the 3rd, 2021. It is not in Prometric guidelines. All right, so enough with that. The privacy curtain. Prometric requires that you provide for privacy. This is patients' rights to have privacy. So when you start your skills, you always want to pull the privacy curtain. When you finish your skill, you want to open the privacy curtain. There should be a curtain for in every by every bed that you're going to test for with Prometric. Pull that curtain. Open that curtain before you go. Now, keep in mind, when you go in and you knock on a door and you may say, "Good morning, Dr. Lee. My name is Miss Jones, and I'm here to do your skill exam. My hands are clean because I washed my hands before I came in. I'm going to pull your privacy curtain." Well, guess what? Once you pull that curtain, what are your hands now? Dirty. Because a lot of people touch that curtain. So once you have introduced yourself and you pull the curtain, you need to wash your hands. Tell the evaluator, I'm washing my hands before I start picking up my clean supplies to do my skill. I got to think clean to dirty, washing my hands. All right. And sometimes I'll get comments as far as, well, Dr. Lee, what about putting a privacy blanket over a patient? Or do we have to do this or have to use a blanket or sheet? I don't care what you cover the patient up with. If there's a chance that the patient is going to be exposed, their body parts is going to be exposed, you need to cover them up. Whether it's with a sheet or blanket, you need to cover the patient up. All right. That's required under indirect care. Now, I have this little man here with his head off because I know a lot of us, we've gotten so much input from different people about how to do skills. You may get it from people that you work with in the hospital or nursing home or doctor's office. You get input from your teachers. You're getting input from different YouTube videos. You're getting input from me. And all of this is going inside of your head. And you're probably saying, oh my God, there's so much. I don't know what to do. We're going to go step by step through these indirect care skills. So hopefully it's going to be easy as we try to put all this information into your head. Okay, so just hold tight. We're going to try to make it real easy for you. We know it's a lot of information here. Now, this is where we start with the indirect care. I'm going to move my picture down just a little bit. Maybe I'll put it down here in the corner. Okay, so for the first skill, ambulation. This is assist the person with ambulation. You will notice that there are 5 different areas that you're going to be graded for indirect care. And this sheet of information that I'm going over here, you can find it under Prometric.com and / whatever state you're living in. So I live in Texas, so I would put Prometric.com / Texas Nurse Aide Skills. And then when I look toward the bottom of the page, there is a link to the indirect care skills. And this is where I got this information from. So number 1, if I'm doing assist the patient with ambulation, that's the skill. Standard precaution infection control, I'm gonna point out some key things that are pretty much the same throughout all of the indirect care. Refrain from touching the resident before hands are clean. End with clean hands. I see that under ambulate. I see it under bedpan. I see it under catheter care. These same 2 things. Before I touch the patient, my hands better be clean. Before I touch the patient, my hands need to be clean. I am graded for that under indirect care. When I end the skill, my hands need to be clean. End the skill with clean hands. And I'm going to, let me pick up a spotlight here. And let me put this up here so I can see where I'm going. Refrain from touching the resident before hands are clean. End with clean hands. Refrain from touching the resident before hands are clean. End with clean hands. Refrain from touching the residents before hands are clean. End with clean hand. A common theme. So what does that mean? When I knock on that door and I say, good morning, Dr. Lee, I'm here to assist you with ambulation, I'm going to stand away and not touch the person. Because some people have a habit of saying, okay, Dr. Lee, I'm here to help you with ambulation. Let me go ahead and give you your call light is here. And I'm going to go around the bed, lock, 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 lock. But when I give them the call light, I touch the patient. Are my hands clean? May not be clean if I pull that curtain to provide for privacy before I told the patient what I'm going to do. Don't get into that mistake. So I would knock on the door. Good morning, Dr. Lee. My name is Miss Mary. I'm here to assist you with ambulation. I'm going to pull the curtain to provide for privacy. And I'm standing away while I'm talking to the patient. And then I will say, I'm going to go and wash my hands, gather my supplies, and I'll be right back. Now, when you wash your hands are clean so that when you come back to the patient to start your skills, you're touching the patient with clean hands. If this is not making sense to you, go watch my videos and you'll see how I demonstrate this so that when, something happened here. Oh, I moved my mouse. So you'll see how I am demonstrating this right here so that when I'm testing, I am not counted wrong with indirect care under standard precaution infection controls. All right. So getting back to ambulate. Checkpoint comfort needs, just check them. So if I'm going to ambulate you while you're walking, I may say, are you dizzy? Are you okay when you stand up? How is walking? Are your legs okay? Talk to your patient. Resident rights. I got some things here that are common things. Announce self or knock before entering in room. I see that here. Refrain from addressing the residents using terms such as Other name as honey, baby, sweetie, those things. Same thing here, same thing here. That means that pretty much all of my skills, I'm gonna have these same things I'm gonna have to pay attention to. And what about safety? Leave the call light in or near the resident's hand or on the bed within reach at the end of the skills. Now, I don't care if you gave me that call light when you first came in and you say, good morning, Dr. Lee, I'm here to help you ambulate. Here's your call bell. Let me give it to you now. I don't care. But I do care before you leave me at the end of the skill that you give me the call light, because this is what Prometric has said we want you to do. It needs to be within reach at the end of the skill. Leave bed in low position at end of skill. So if you never move the bed up or down, the bed is already in low position. So just leave it there. Don't move it. Don't raise it up to your waist level. Leave the bed alone. Same thing here. Same thing here. Okay. Now that's ambulate. Let's go to bedpan. Are there some extra things for bedpan for indirect care? Yes. Avoid placing the bedpan directly on the overbed table. Again, if you go back and watch my videos, you will see that I put a towel over the bedside table and I put my supplies on top of the towel, not directly on the overbed table. Avoid holding clean or dirty linen against your clothes. Avoid placing linen directly on the floor. Aha, now I have gloves for bedpan. Remove gloves without contaminating self. So now I know I need to have gloves for bedpan. Okay. I need to have gloves for bedpan. I need to have gloves for also what? Catheter care. Okay. Ask resident about the comfort of the bedpan or position before leaving to use the bedpan. So when you put them on the bedpan, is this okay for you? Talk to them. Am I putting the privacy curtain up? Leave resident covered with a top sheet while using the bedpan and at the end of skills. Arms do not need to be covered, but I need to keep their chest, abdomen, legs part covered. Okay. These are the, if I have this skill, this is what I'm going to be tested on for indirect care. Let's go to catheter care. Pretty much the same as with bedpan, except for now, use bath basin for bathing water. So don't go get a little emesis bowl. Don't just bring, I've seen some people bring over those baby wipes. You have to use the bath basin because you need to have the resident check the comfort of the water temperature. You should be asking the patient, is this water okay for you? These were going to be what you're going to be graded for under indirect care. Minimize exposure of the resident while bathing. So in other words, for catheter care, you will only have uncovered between the hip and the knee. Everything else, resident needs to be covered, and leave resident covered with a top sheet, a top covering. Okay. Let's go to the next three. Changing an occupied bed. Still same 5 areas for all of the skills. You have the skill, standard precaution, comfort needs, rights, and safety. Again, same recurrent theme. Refrain from touching the resident before your hands are clean. In with clean hands. Same thing here. Same thing here. Okay, now I've gotten a lot of questions in the comment section about the occupied bed. And some people will say, Dr. Lee, don't I have to have on gloves when I'm making an occupied bed because we don't know what's up under the sheet? If I was in the real world testing at a hospital, or if I was in a nursing home and I'm making somebody's bed, yeah, I would put gloves on. But remember, I'm in a testing environment. I am in a controlled environment. Prometric does not require putting gloves on for changing an occupied bed, for changing the position, or for dressing. You can't see the end, the bottom part here, but for dressing, gloves are not required. And you can go back and look at it. Gloves are not required. If you want to put on gloves for any one of these positions, you have every right to put them on. It's not required. But if you put them on, you will be graded on whether or not you take them off at the appropriate time, you take them off correctly without contaminating yourself, and that you wash your hands immediately once those gloves hit the trash. I'm going to say again, wearing gloves is not required for changing an occupied bed, for a position on side to change the position, or for dressing. Gloves are not required, but you can put them on if you want to. When gloves are required, it will tell you, put the gloves on. Okay, so same thing with changing occupied bed. You're not putting dirty linen on the floor. You're not putting linen, dirty linen on the overbed table. You're not shaking the linen out. All of those will cause you to flunk under indirect care. Same thing with the rights, pretty much. Announce yourself, address the patient by name, close the privacy curtain before providing care. Refrain from leaving the resident completely uncovered while top sheet is being replaced. The resident have to be kept covered. Change of position. Avoid holding pillow fully against clothing. Okay, so you need to hold your hand out, put that pillow in the pillowcase, and bring it, but don't shake it down. Close the privacy curtain again for change of position. Leave resident covered with top sheet at end of skills. Now, okay, sometimes people will go, okay, but I'm changing their position. I'm putting them in an occupied bed. What about the side rails? I have to put side rails up because they may fall over. Don't make that mistake. Prometric does not require the use of side rails. They want you to move the patient over to the side toward you, then turn the person over so that the patient stays in the middle of the bed. If that does not make sense to you, go watch my video. I explained to you how to position a patient when you don't have side rails. Side rails are not required for changing an occupied bed or for change of position. Side rails are not required. That is under Pearson View, not under Prometric. And when you do it, you still have to move the patient over the way that Prometric requires you to do it. So you have to think the way Prometric wants you to think to pass the state exam. Let's go to safety. Leave call light in or near the resident's hand at the end of the skill. Same thing here. Leave call light in or near resident's hand on side turn toward at end of skill. So I have to remember that if I'm turning you toward the right side, then your call light needs to be on that right side. Don't put it over here on the left side of the bed. Put it over on the right side of the bed. Now, when I'm dressing, remember I said about the call light. The evaluator will tell you which arm is weak. I have to pay attention to that because whatever arm that the evaluator says is weak, I need to put the call light in the opposite hand, in the strong hand, or on the stronger side for the patient to reach the call light. This would be a grade under indirect care. This little thing with the call light is a big deal because I need to pass all 5 skills. And I don't want not giving the resident the call light in the appropriate hand to be a reason why I do not pass the state exam. So I am going over these indirect care skills so that hopefully it is clear to you and that you pay attention to these little details that Prometric has so nicely provided for us so that we can pass this state exam. Let's go to the next 3. Feeding, foot care, hand and nail care. For feeding, I'm going to be just brief here because right now during COVID-19, we're not going to be tested under feeding because we're keeping our mask on in Texas area. So as soon as we're through with the COVID-19 epidemic and we don't have to wear the mask, they will start back grading under feeding, and I will come back and do a whole nother video on feeding. So I'm just going to bypass that because you don't have to worry about it right now. There may be questions on the written exam about feeding, but you don't have to worry about it as far as doing a skill, because we won't do it right now under Prometric. All right. Foot care. Okay. Refrain from touching the resident before hands are clean. In with clean hands. Avoid placing dirty linen directly on the overbed table. Avoid holding clean or dirty linen against clothing. Avoid placing linen directly on floor, except when used a barrier during foot care. Remove gloves, now I got here, if worn, without contaminating self. Now that little last bullet point confuses a lot of people. Remove gloves if worn. So are you saying, Dr. Lee, I really don't have to use gloves for foot care? That is exactly what I'm saying. Prometric does not require the use of gloves for foot care unless you want to, because they have if worn. Now, why is that? Because normally with the feet, there are not open areas, rashes, or things where I may come in contact with body fluid on the feet. You do have to wear gloves for perineal care. You do have to wear gloves when you're doing a bath because you're going around the face. So I'm going by your eye, which can be a source for infection, your nares, your oral cavity, all of those are sources for infection. So I need gloves on. If I'm doing catheter care because I'm in the private area, genitals, I need gloves on. But for foot care, it's optional. When I'm testing under Prometric, I want to make sure that you all see this. Remove gloves if worn without contaminating self. And you better know when to remove them. Pretty much everything, I'm sorry, is moving. My mouse is moving when I move it over. So pretty much everything else is the same as far as announcing, how you address the patient using a privacy curtain, and the bed. So some people have a problem with the privacy curtain. You mean for foot care, I need privacy curtain? Yes. Anytime I'm doing care with that patient, I'm bathing, I need to pull the privacy curtain. Yes, you do. Hand and nail care, pretty much the same things here. Ask the resident about anytime I'm using water on a patient, I must ask the patient about the comfort. I'm sorry, you all. I must ask the patient about the comfort of the water. The comfort of the water. Have them check the water. Okay. Let's go to the next three. And if I'm going too fast for you all, if you have any specific questions about any one of these skills and the indirect care, how it relates to these skills, just leave comments down below and I'll be sure to address your comments, okay? So I want to make sure that you all understand this so that you can do very well when you take your state exam. Measuring urinary output. So when I'm doing urinary output, guess what? I'm handling waste product. So what is it? Gloves. I need gloves on. If worn without contaminating self. But when you look at the skill, it will tell you about putting gloves on because you're dealing with waste products. Same thing about the linens, pretty much the same. See what's different, anything different? Nope, the same. Measuring pulse. Let's do pulse and respiration together. Do I need gloves to take a person's pulse of respiration? No, no. Because I'm going to wash my hands before I touch the patient, and I'm going to wash my hands after the skill, before I say I'm through with that skill at the end of it. So I don't have to put gloves on unless I want to. Just move on. Do your skill, wash your hands, document it, give the patient a call light, wash your hands again at the end of the skill. Teeth brushing, this is another one right now during the COVID epidemic that we're not doing. So I'm gonna move past this one. Once we get past COVID, I'll come back, like I said, and I'll do a detailed video on the 3 oral care skills that we're not doing. The feeding, the teeth brushing, and denture care. Those are the 3 that we're not doing right now during COVID. Denture care just popped up, so we'll leave that one. Now, partial bath and perineal care, gloves. You have to have on gloves. You have to have on gloves. And it will say that in the skill. Same thing, you don't put clean or dirty linen against your clothing. You must have the patient check the water temperature, check the water before. You must use the privacy curtain here. Leave the resident covered for the bath. Leave the resident covered. Call light in or near the resident's hand at the end of the skill. Okay. And then the last to the range of motions. When I'm doing range of motion, it does not require gloves. So whether you're doing the arm, the wrist, and the elbow, you're doing the leg, it doesn't matter. Gloves are not required unless you want to use them. And then again, if you put them on when it's not required, you better take them off at the appropriate time, appropriately, and wash your hands once you're through with them, because you will be graded on the removal of the gloves and at the time that you remove the gloves, if you decide to put the gloves on when they're not required. Trying to think. Leave the resident covered with a top sheet at the completion of the range of motion. Call light in reach. And for transfer, again, nothing here under safety does it say to go around and check all the bed wheels. Lock, 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 lock. That's what I hear people do. Lock, 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 lock. And they'll go walk to the head of the bed, foot of the bed, head of the bed, foot of the bed. For Prometric, you don't have to do that. The bed will already be in a low position and the bed wheels will be locked. This is safety, not only for the client, but for you who are testing. Prometric is not going to tell the evaluator to unlock all the wheels and then have the client get in the bed, because you're at risk of falling just like a client is in the workplace. So the bed will already be locked. The bed will be low. Only thing you have to do is leave the bed in the low position. Don't mess with the bed. But you have rights. And if you want to mess with the bed, go ahead on and mess with it. But make sure you bring that bed back down low before you say that you're through with your skill. Okay, and this is transfer. Checkpoints for transfer. When you have the resident sit on the side of the bed, I may ask the resident, are you feeling dizzy, lightheaded? Are you comfortable? Before I get you from the bed and take you to the wheelchair, make sure they have their shoes on, things like that. When you get them in the wheelchair, make sure that their buttocks is back up against the back of the chair. They're not sitting toward the front where they may tip over and fall. All right, so this is indirect care. I hope it was clear for you. I just wanted to give you a little bit of an understanding about indirect care and the importance of it. I'm gonna stop sharing my screen right here. If you have any questions whatsoever, please leave comments down below. If this video has been helpful to you to understand how you're going to be graded for indirect care skills, please hit the subscribe button below. It's very important for me to keep the videos on YouTube that you hit the subscribe button below and give me a thumbs up if you really like it. Any comments whatsoever, again, I say leave them down below. I am in Texas, but I've looked at Prometric guidelines and they're pretty much the same across the nation in the states that Prometric tests in. I'm more than happy to answer any questions to supplement whatever it is that you're getting from your instructor about the Prometric skills. All right. So with that, I want to say Happy New Year to everybody, and good luck on your exam. I know that you're going to do very, very well. I look forward to seeing you in the workplace, working beside you. So long, and I will see you in the next video. Goodbye.